Hello, I'm Dr. Andy Manganaro, Chief Medical Officer at Lifeline Screening. I worked for over 30 years as a cardiothoracic and vascular surgeon, and I became frustrated when I saw patients admitted to the hospital near death who could have been treated safely had their ruptured abdominal aneurysms been found earlier, as well as patients on my operating table with serious disease in their carotid arteries who could have been managed safely and even without surgery if it had been found earlier. That's why I got involved with Lifeline Screening more than 12 years ago. This video is going to take you through our 5 most common screenings and tell you what the results mean. In general, we're looking for plaque buildup in the arteries. This is called atherosclerosis. Atherosclerosis is a disease of progression. Its progression can be slowed or halted even by medication and management of your risk factors, such as stopping smoking, monitoring your blood sugar, particularly if you're diabetic, doing exercise, and watching your weight. Now, we recognize that some of these are challenging, so if you're having trouble maintaining these lifestyle changes, we recommend you follow up to see if things are getting worse in about a year. If you are making these lifestyle changes, you may want to get checked to see if things are getting better. The carotid arteries are located one on each side of your neck, and these bring blood to your brain. If your ultrasound scan revealed mild or moderate blockage, this means your artery does have plaque in it, and it may be affecting the blood flow depending upon the severity of the blockage. This does not mean you are in any immediate danger, but it is something you should share with your doctor because it does increase your risk for stroke. If we reported that you had severe blockage, this means the blockage may represent an immediate threat to your brain. You should then consult a doctor as soon as you can. The abdominal aortic aneurysm test looks for an abnormal enlargement in the large artery in your belly. This is the largest artery in the body, and the normal size of aorta is about the size of my thumb, just like that. That's about 2 centimeters to 2.5 centimeters. If we indicated that your abdominal aortic aneurysm screening was abnormal, that means our measurements show the size of your aorta is 3 centimeters or above and should be reviewed by a doctor. The larger the measurement, the sooner you should consult with a physician. A size of 5 centimeters or greater is considered critical and at risk for rupture. The atrial fibrillation, or AFib test, looks for the most common type of abnormal heart rhythm and is related to a problem with the electrical signals of your heart. It can affect the flow of blood to your brain, as well as other organs, which is why it's associated with an increased risk for stroke, as well as kidney disease, heart failure, and heart attack. If we indicate you have atrial fibrillation, or we have called you to talk about this from our office, please share those results with your doctor as soon as you can, as treatments are available to decrease the risk of those complications. The peripheral artery disease, or PAD test, examines the arteries in your legs, which can become blocked partially or completely by atherosclerotic plaque and cause a decrease in blood flow to the legs. PAD is often used as a marker for the presence of cardiovascular disease in other parts of your body. So, if we have marked your test abnormal, your doctor may not only want to do a diagnostic test for PAD, but also may use this as an opportunity to do tests that can reveal more widespread cardiovascular disease, such as coronary artery disease in the heart. The osteoporosis risk screening measures the bone density in your heel, which can be used to determine if you may be at risk for osteoporosis. Keep in mind, though, that a moderate or even high-risk result does not mean you have the disease osteoporosis. It does mean you may want further tests to see where you stand. Please share all of your results, normal or abnormal, with your doctor, who can help you determine what next steps may be right for you. And we'll see you next year.